We ask that you just continue to watch over watch over us, watch over our families, help guide us as a council to help make decisions for our city. We also ask that you continue to watch our servicemen here and abroad and keep them safe. In your name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, I'll call to order the Monday, March 6, 2017 City Council meeting. Mrs. Powell, roll call, please.
Branch.
Here.
Graham.
Here.
Henry.
Here.
Hussey. Lubert.
Here.
Mahalovich.
Here.
Prather.
Here.
Schreiber.
Here.
Ward. Here. Wiseman.
Here. All right. Item 3, is there a motion to adopt the agenda?
So move.
Second.
Any further discussion? All in favor?
Aye.
Any opposed? Motion passes. And at this time, I'd like to recognize there's some Boy Scouts that we have in the audience. We always welcome the Scouts who are here. And would you all like to come up to the podium and give us your name and what school you go to? And you're welcome to mention if you're working on any specific badge or project. And your troop number. Welcome. We're glad to have you all here tonight.
Hello, I am Jaden Slaughter. I go to LC, and we are working on citizenship in the community.
Great. Welcome.
My name is Bradley, and I too am from LC. And I'm also doing citizenship in the community.
Great. Welcome.
I'm Jonathan Isaacs. I go to Thomas Jefferson Middle School. We are working on citizenship in the community, and we're part of Troop 333.
Great. Well, we're glad to have you all here tonight. Thank you very much. Are there any other Scouts here tonight? Okay. Great. Thank you for being here. Item 4, miscellaneous agenda items. Any others? Item 5, there's no public hearings. Item 6, appointments by the mayor. I'll have Gail summarize them, and then I'll have a motion.
Thank you, Mayor. We have there are a recommendation for 2 reappointments to the Airport Advisory Board, 2 reappointments to the Cultural Arts Commission, and 1 reappointment to the Library Board of Directors. And then there's one recommendation for a new appointment, and that's Willie Jude to the TIF Commission.
Great. Are there any questions for Gail? Do we have a motion to accept these appointees?
So moved.
Second.
Second.
Any further discussion? All in favor?
Aye.
Any opposed? Motion carries. I will say that there are still some openings on the Cultural Arts Commission if any citizens are interested in serving on that commission. Item 7, presentation from staff, consultants, and invited guests. We have with us tonight Superintendent Larry Linthicum from Jefferson City Public Schools. Welcome, Larry. And we're glad to have you here tonight. And we know you have an upcoming ballot issue on April 4th and wanted to hear from you as it does affect the city as a whole. So thank you for being here at our City Council meeting.
Thank you, Mayor. Thank you, City Council. My name is Larry Linthicum. Glad to be here tonight. Just a couple minutes, couple highlights. Each of you should have a copy of our one-page handout. We do have 28 days from today or 4 weeks from tomorrow on the April 4th ballot. There are 2 propositions. It's Proposition J and Proposition C. The Proposition J is for the bricks and mortar for a second high school and renovating the current high school and Nichols Career Center. And then Proposition C is the operating aspect to operate that. So gave some highlights. We believe in giving kids opportunities to reach their potential through a smaller learning environment, smaller class sizes. We do believe a second high school contributes toward raising the bar. We have many traditions of pride through excellence here for Jefferson City Public Schools, and we feel like that this aligns with that. We do not feel that a second high school is the silver bullet for us to do that. Whether we have 1 high school or 2 high schools, we're trying to raise the bar in everything we do. So we are out of space. Gave some highlights there. It is a $1.10 increase from $3.69 to $4.79, And we are excited about this. One crucial part of it, I believe, is to ensure that it's not the haves and the have-nots, that it's not a Band-Aid approach on the current high school, but that it's very similar. The goal of our architects have shared with us is that if once folks look at both schools, if they move to Jefferson City, when they drove by 609 Union where the current high school is, or drove by where the second high school is, that they couldn't tell which high school they want to go to. So that's our goal. There will not be one part of the current high school that is not touched by the renovation. It's $45 million that's included in the current high school, and then $85 million for the second high school. So we feel like it's a reasonable request. We're in the bottom third of the state levy-wise. We'll still be below the average of similar-sized schools in Missouri. Those facts are included here on your sheet. And again, we're excited about it and giving kids opportunities to address our space needs here with the second high school. So do you guys have any questions for me on any parts of this? I presented it, this is I think number 36 for me. I've got 19 left here in the next 28 days as we've been presenting in many different venues. I think it'll be again here tomorrow night after I'm with the parents tomorrow night at Pioneer Trail at 6, and then I'll be here as soon as I finish there tomorrow night. So we're looking forward to that. So any questions you'd like to ask or anything that might clarify anything?
Any questions of council for Mr. Linthicum? And you touched on briefly, Larry, the forum tomorrow night, which is Tuesday night, March 7th, here
Right.
at City Council Chambers at 6 p.m. From 6 to 7, there is a there's a school board candidate forum.
Correct.
And then from 7 to 8 is the levy forum, open forum. So
Correct. We do have at 6 p.m. scheduled, that we've had scheduled for quite some time, at 6 o'clock with the parents of Pioneer Trail. And so we'll get here as soon as that's complete. I think there's going to be some other representatives from the Citizens Committee. There's a Citizens Investing in J+C that we're excited about. Warren Kretsch, Carlos Graham, Dan Westhughes are the three chairs for our Citizens Committee, Citizens Investing in J+C. So some of those may be present here tomorrow night until I get here from my parent meeting. So if my delay, hope folks will understand that prior engagement to meet with the parents regarding this same topic tomorrow night. So
if people want to get involved, Larry, how can they get more information as far as getting involved in this?
absolutely, involvement-wise, there's kind of two parts. From a school district standpoint, by law, we can just educate folks on the different components of it. The Citizens Committee is more the persuasive. Brenda Hatfield is the campaign coordinator. I believe her email address may be on the, it is not, because this is just a factual sheet. I can't persuade you. I just give you the, educate you on the different components. But if you have any interest on that, we can put you in touch with her. If there's some questions on this part, you can contact our central office at 659-3012. I'll be more than happy to talk to you about any aspect or over a cup of coffee, any of the parts of it, as there's a lot of, it's been discussed for a long time in this community, and we recognize that. We're trying to be very transparent, very open about all the different parts and the impacts of that throughout our community. It truly is an investment for our community, and as we move forward, we want our school system to be an asset to our community, not a liability, and to draw folks here, and we're excited about this proposal.
We
So.
appreciate that. Also appreciate Councilman Graham for serving as a tri-chair for this very important effort. Councilman Graham?
Madam Mayor, and to the City Council, and to the people who are listening and the ones who are in the audience, one of the ways you can get involved is starting this weekend, we're going to start our door knocking campaign. So that will run for the next 4 weeks. So if you would like to go out and knock on doors with us, please contact Brenda Hatfield, and she will get you signed up. So that's one of the ways in which you can help, other than going out and voting yes on J and C.
Thank you,
Thank you.
Councilman Graham. I will be out there knocking at some point, so you might see me at a door, but I say that because I really believe in this, and this is something that's very important for the community. And as a mayor, I know that we need to move our community forward, and the schools are such an important aspect of that, and it's important that all of our schools are strong in our community, and we know very well that people are looking at our schools if they're looking to locate here in Jefferson City, if they want to stay here in Jefferson City. Everyone in the population in one way or another is touched by these students as they grow and become members of our community. So as they go through our school system, those are the ones that we are interacting with, and those are the ones that are helping us. We're helping each other as they become members members of our citizens in our community as well. So looking forward to supporting that, and it's such an important piece of our community that I thank you for taking the time to come here tonight. So, and I know one question I had received, and I think this has been answered, but kind of odd, but not really, is what will this do to the football team? And I know that you've mentioned that somebody is very supportive as well.
That is a good question. We hear all kinds of questions, but that is one. The football team and our overall community and athletics we'll have two teams. We had an endorsement from Coach Atkins himself and said that he bleeds red and black. I wish we could have one high school, but he feels it's time for us to have two high schools. So they would compete against each other. Father Jones is present here tonight, I believe. We'd compete against Elias as well. The tide rises all ships, and through all athletics, through all extracurricular, through in the classroom, it's all part of the educational experience for our kids. So we believe in student success through sports, through all other activities. Yesterday I attended the band concert at the high school, 7th through 12th grade, and they hit it out of the park. Brett Myers, they do a great job with that. So it's not just about sports, it's not just about the academics, it's about all of us together. Community-wise, we believe we're stronger together, and we're excited moving forward with this proposal.
So more opportunities for more students. So
Absolutely.
Thank you very much. And I know people have often asked, what would Coach Atkins think? So that's good to hear that perspective. And Father Jones, thank you for being here. That's very nice of you to be here tonight as well. Appreciate that, and very exciting to have you all here. Thank you, Mr. Linthicum.
No question? Yes,
Councilwoman,
fire
I do
away.
have a question. In the event that that J passes and C does not, what will be your course of action in that event?
That's a great question. Proposition J, because there's two parts, that's the bricks and mortar. So if J passes, which does require a 4/7 vote, if that passes, we'll do some exit polling and ask folks, did you support it, yay or nay, why or why not, as we learn from that. Realistically, if Proposition J passed and Proposition C did not, we would, after we do that exit polling to determine a course of action moving forward, that we probably come back to the voters as early as possibly August. The Proposition J is a 4/7, and that's a 4/7 in April. If that did not pass, it would be 2/3 approval, and this is required by law. We're not setting this if we ran that in August or November. So realistically, we would come back in the spring of 18 on Proposition J. But if J passed, as you indicated, Proposition C is a simple majority, regardless of whether it's in April, August, or November. So it's based on an odd year and even year. We didn't set the law on that. Our hands are tied on that. But we do some exit polling and have a course of action moving forward and make sure we communicate with folks along the way with regards to that. You're welcome.
All right. Thank you, Mr.
Okay,
Linthicum,
thank
for
you,
being
guys.
here. Appreciate it. All right. Item 8, announcements by mayor, council, and staff. We do have an announcement tonight by Fire Chief Matt Schofield.
Thank you, Madam Mayor. Wanted to make everybody aware that tomorrow, March 7th at 10 a.m., there is a statewide severe weather drill that's scheduled. And even though, as most of you are probably aware, there is some pending inclement weather this evening, we're told that most of that will be cleared out of our area by about 4 a.m. If that is the case, the drill will continue as planned. If for some reason we still have lingering weather issues, the backup day is Thursday, March 9th at 10 a.m. So just want to make sure everybody was aware that that will occur, and I believe those announcements will be made over our citywide emergency sirens.
Thank you, Chief Schofield. And our council committee meetings, for a complete schedule, you can check our website at jeffersoncitymo.gov for meeting calendar and information and agendas. Do any councilmen have announcements about committees this evening or other announcements? Councilman Prather?
We do have a finance meeting this Thursday across the hall at 7:30.
Great, thank you. Any other committees would like to announce tonight? Okay. I have a couple of announcements. There was a Capitol Avenue public meeting on Monday night here in council chambers where staff presented some plans for the overlay district, and that was very well attended. We had a full council chambers, so there is a spot on the website about all of the Capitol Avenue information, so I'd urge you to look at that, as we have two things going on. One is the blight study and the House process, and the other is the overlay district, so a lot of those things are available. Also want to announce that the city is working with the state right now and asking that a portion of the old prison site be used for furthering redevelopment. So we do have two bills right now, in the legislature. One is Senate Bill 486, sponsored by Senator Kehoe, and the other is House Bill 1099, sponsored by Representative Bernsketter. So our hope is that we can continue our collaboration and partnership between the city and the state for a portion of the land at MSP, basically from Chestnut Street to the historic tour area. And the historic tours would remain as they currently are under a partnership with the state. So a very exciting time to finally have a bill in the Capitol that hopefully will allow the city to further some redevelopment aspects there. So we'll keep you posted when we know about a hearing and information on that. So those are my announcements. Are there any further announcements tonight? All right. Item 9, Lincoln University student update. Jonathan Jackson was not able to join us tonight. Item 10, presentations from the gallery on specific bills and resolutions. And individuals will have 5 minutes to make a presentation on items that are already listed on the agenda tonight. We did have a sign-in sheet. I know we have on here item A, the medical community regarding Bill 2016-120. So we may go through all of the folks that are here to speak about 120, and then we'll do the other ones, which is we have some people here to speak on 114, which is the prescription drug monitoring. So does that sound okay? Unless there's anybody who needs to leave. I know Jim Marshall, has he made it here tonight? I know he needed to leave early. Is he here? I would say, Coach Marshall, you're here to speak on the second one, but I know with you had to get to another meeting to speak on PMWP. Would you want to speak now? Okay. Thank you. And you may just be here in support anyway, because you did speak at the last 2 meetings, so just wanted to make sure with your schedule. So we will go through everyone from the medical community who's here. We have regarding Bill 2016-120, so we have Mr. Deacon Black signed up for that particular item. Welcome, Deacon.
Hi.
And you can pull that down too if you'd like. There you go. Thank you. Welcome.
Hi, my name is Deacon Black, and I'm here to discuss why the age of buying tobacco products should be changed from 18 to 21.
Wonderful. We're glad to have you here tonight.
And here are my reasons. More than 95% of long-term smokers started before the age of 21. And that can be really bad. It can give them cancer or heart disease. It can hurt them really bad. And e-cigarettes contain nicotine, toxic chemicals, and carcinogens, and are currently available to 18-year-olds. On average, youth try cigarettes for the first time at age 12. That's really young. Like, I'm 11. I just turned 11 today, and that's 1 year away. This is very important. I came on my birthday just to talk about this.
Wow.
Anywho,
You're doing a great job, Deacon.
thank you. This is, I'm very nervous. This is.
You're doing great.
Yeah.
You're doing really great. Yes.
While youth smoking cigarettes is slowly declining, e-cigarette use among youth has more than doubled in the recent years. And that's a lot of smoking e-cigarettes, which contain nicotine, and obsolete brains are still developing and are uniquely sensitive to the nicotine addiction. Ooh. And the primary place that underage smokers get their tobacco products from are their 18 to 20-year-old peers. So if we raise that, it can reduce smoking by 12%, which, yeah. So if we reduce this, by doing this, a minor shall mean any person under the age of 21 years old will not be able to use tobacco products, which will reduce the amount of smoking. And I know that older, like brothers or sisters, have siblings that, and the younger siblings can get these tobacco products from their older peers. So if we raise the age, it can reduce that, getting the tobacco from their older siblings. Among 15 to 17-year-olds by 25%, and among 18-year-olds can reduce it by 15%, and 25 for the 15, 17, and 18 to 20 by 15, which it can reduce all the smoking ages. Thank you for your time.
Thank you, Deacon. That's great. I'm very proud of you for being here and presenting. That really means a lot, that you think enough of this, that you would come here on your birthday and talk to us about this and inform the council of how you feel. So thank you. And I'll open it up to, does the council have any questions for Deacon? Well, thank you for being here. And I don't normally get pictures from the speakers, the presenters, but tonight, if you don't mind, if you want to come up, I'd love to get a picture with you, and it's your birthday and you're here, and I'm really impressed that you are here on, so we're going to get a birthday picture too. So if you would come on up. Do you have your camera handy? I have to say, Deacon, someday you might be sitting up here as a councilman, so keep up the good work on that, and thanks to your family for being here.
It does run in the family.
Great job. Thank you very much. All right, the next we have Karen Englert. It's going to be hard to follow Deacon, but welcome, Karen. Welcome.
Thank you, Mayor Turgeon and members of the council. My name is Karen Englert, and I work for the American Heart Association. My focus is on all of our public policy, especially related to prevention. I live in the St. Louis area, but I spend about half of my year in Jeff City at the big building over there, quite a bit. But really am very excited to come over here tonight and talk to you about Tobacco 21. Actually, I've been involved in this process really since this kind of came up last year, attended quite a few of those committee meetings as well, but really am very pleased to see it has kind of resurfaced and about the opportunities with that. So as Deacon mentioned, we know that 95% of smokers start before they are 21 years old. Many of them have that very first cigarette by the time they're 18. And unfortunately, we know that it only takes about 100 cigarettes, period, to become addicted. We also know that people often try to quit about 10 times before they're successful. So the odds are stacked against them. Our goal with Tobacco 21 is purely focused on preventing youth from ever starting. I'm a mom. I have 4 kids. Some of them are teenagers. My goal is for my kids to never face that challenge of ever starting to smoke and then trying to figure out a way to quit smoking as well. We also know that youth rates are unfortunately increasing again. They had been decreasing for a while. We had seen a pretty sharp decrease from 2007 to 14, But in 2014, between e-cigarettes and normal tobacco products, the rates have really climbed again. And that's very concerning for us. So we began to really look at what is one effective way to reduce youth tobacco. And so we came across, as many people have, the case study from Needham, Massachusetts, which I believe a lot of you have heard about. But in Needham, it really was a beautiful thing where two people came together, they saw a problem, and they came up with a very innovative way to solve that problem. And so that is where Tobacco 21 came from. That was passed in 2005. And one of the things we appreciate as an organization is you can study that. You can look at the science behind it, because we're a science-based organization. You can look at that, and you can see the significant decrease in youth initiation rates. And youth there had the opportunity to go somewhere else to purchase tobacco products, and they haven't done it. It was a very successful policy for Needham, and so it has caught on, and it's caught on with significant momentum. So here in the state of Missouri, we have 10 jurisdictions that have passed that. But I feel like that really doesn't give credit to the work that's been done with Tobacco 21, because within that 10 jurisdictions, that's over 100 municipalities. So that's significant impact in our state. We have almost 34% of our state that is covered by Tobacco 21 policy. And so that is very significant. And we're really excited to add Jefferson City to that list. We know it does significant work in terms of youth prevention. And for us, it is important to talk about, okay, well, what is the number of lives saved, right? Other people are going to talk to you about economics, and I leave that to them. We're a health-based organization. But I want to talk to you about the human impact. Because when we look at Tobacco 21 and we study it year after year after year, and we look at it in your community, we know that in 10 years, we will see 110 lives saved. But it's not really just 110 lives, because those are kids who will later have kids, who will later have kids. Those are your kids. They're going to grow up here, have families here, contribute to your economy, be active participants here. And so it's much more than that 110, and honestly, that 110 should be reason enough. I think of my 4 kids. If those 4 are part of that 110, I promise that's plenty of reason for me. When we talk, though, about support for Tobacco 21, it's also important to notice that we have so much support across all areas. Former smokers, current smokers who wish they had never started. All socioeconomic issues. We know that tobacco industry really targets our minorities. They target our populations with lower socioeconomic needs. And so anything we can do to level that playing field is an important step we can take. Our schools really highly support this initiative because it takes tobacco out of their schools. And that is a huge thing we can do for them. So really in closing, I want to say I'm so excited to see this back here in front of the council. Any support we can offer as the American Heart Association, we are happy to do that. I believe I was able to get in touch with most of you via email recently, but please feel free to let me know if you have any questions.
Any questions for Mrs. Englert? All right. Well, thank you for being here and all the work that the American Heart Association does. Thank you. Next we have Dan Thompson. Welcome, Dan.
Hi, good evening, and thank you. My name is Dan Thompson. I'm a facilitator with the Council for Drug-Free Youth. I'm also a retired military, and I just want to express some of my experiences that I dealt with dealing with the military, the age group that we've talked about a little bit, and how smoking has an effect on that. And I just want to point out I am retired, and any of my opinions and experiences are strictly mine and not any of the United States military, so I just want to throw that out there. I spent about 14 years in the Missouri Army National Guard as a recruiter, and so we dealt with a lot of from 17 to 21-year-olds, really 22-year-olds. That was kind of our prime target as far as recruiting goes. So one of the big issues was that is, you know, we would have these young men and women come in and they would want to join, and some of them had already started smoking. And like they had pointed out, if you start smoking before the age of 21, some even say as high as 25, 26, the odds are you're going to get hooked, and it's going to be very, very hard for you to quit. So what we look at, especially in the military, is a readiness aspect. And when that happens, you know, you bring in a 17 to 21-year-old and they've already been smoking, it's very, very hard for them just to meet the minimum physical conditioning standards that it takes to actually be in the military. Bottom line, what that affects is that affects our readiness as far as the ability to be able to perform our duties, protecting to the state, the nation, and so forth. Now, obviously, not everybody in Jefferson City is going to join the military, so it's not just about that, but it also brings it home a little bit closer in terms of readiness of our employers, their abilities to workers to be able to perform their specific duties in whatever capacity that is. So what happens is you look at increased health costs, you look at absenteeism because of those particular health issues that they have, so it all mounts up. And so, like I said, if we could raise that age up to 21, that would do a lot to get some of those younger kids from getting hooked. And as Deacon had so eloquently pointed out, that's where it all starts. And so if we can stop it there, that just makes it a lot better and, like I said, reduce cost in the long run. So I would simply encourage you to really take this in consideration and hopefully bump that age up to 21 so we can reduce that. So thank you very much for your time.
Well, first of all, thank you for your service
Oh,
to
no
our
problem.
country. Appreciate
You're
that. And does council have any questions for Mr. Thompson? I appreciate hearing your perspective because that's
Right,
something we
right.
often hear is what would people think in the military because, if they can fight for our country, then why can't they buy cigarettes? And so your perspective is a good reason why. So appreciate your
Thank you.
time tonight. Thank you. We have Mr. Brent Van Konya, President of SSM Health. Welcome, Brent.
Good evening. I know you'll hear from a few other folks with a few more of the technical details. I'm really here just to represent St. Mary's as one of the largest employers in town, as well as the medical community to strongly support and endorse this bill. Part I'll share is this requires courageous leadership on the part of the council. St. Mary's was actually a leader in becoming a smoke-free campus in the healthcare community years ago before the state adopted regulations that require all hospitals to go smoke-free. We got a lot of criticism for that. We got a lot of complaints from our employees as a result of that, but it was the right thing to do. As a result, we do have a few folks who still drive off campus because they want to smoke or need to smoke, but we've seen a significant reduction in smokers among our employees, as well as a reduction in smoking among family members or patients who try to smoke while they're at the hospital. I know how difficult then it is for you all to make this decision. Nobody can say it better, though, than Deacon Black can say it, quite honestly. And you've already heard that we are not the first. So the one thing that here is, it's most difficult to be a pioneer or that first adopter, but we're really talking to be an early adopter because we have 10 jurisdictions, 100 municipalities, 34% of the state has already adopted Tobacco 21. We're the state capital city. We should be actually leader in many of these initiatives. And as part of what we're trying to do to grow Jefferson City, being a leader in lifestyle and healthy living is one of the things that will continue to attract and retain our youth to come back to the city. So we strongly support this bill.
Thank you, Mr. Van Konya. Any questions from council?
Questions?
All right. Thank you. And next we have Gasper Calvaruso, President of Capital Region. Welcome.
Good evening, Mayor. Good evening, Council. Much like Brent, we're a large employer here, the largest employer in Jefferson City outside of the state, and we are supportive of this particular initiative. I'm going to talk a little bit about community, and both hospitals here in town have an obligation to do a community health needs assessment every 3 years, both SSM Health as well as Capital Region Medical Center. And we've done this twice, and both times substance abuse has been a priority issue. Specifically smoking. Smoking is one of the top 5 risk factors in our community for a four-county region here and around Jefferson City. And I know we're talking about the city of Jefferson, but we look to affect change. How can we as healthcare organizations affect change and try to change those numbers? And so we perform smoking cessation classes. We have a number of other opportunities to do that, kind of post smoking, but this is the first opportunity we have to actually address things from the very beginning. And as our young speaker spoke about, I mean, this is really an initiative that can affect change. So I'm here to support this initiative. I also want to mention that Tobacco 21 has identified well over 40 organizations, so it's not just the healthcare community that is supportive of this. Many of our large businesses, as well as associations associated with trying to improve the health and wellness of our community, are supportive as well.
All right. Thank you, Mr. Calvaruso. Any questions? Councilman Mihaljevic?
Thank you for the testimony. Do we have a copy of those organizations?
I can submit this if you'd like to pass it around.
We'll submit that to our city clerk, and she'll make sure that council gets a copy of that. Thank you. And I really appreciate, any further questions for Mr. Calvaruso? And I do appreciate the hospitals working together, seeing SSM and Cap Region together on this issue and working together on something that's important for our community. It means a lot. So thank you both for being here. Thank you. Appreciate our hospital support and for being our top employers in the community as well. Next we have Jenny Chadwick. Welcome.
Thank you. Thanks, Carrie, and members of the council. I'm Jenny Chadwick. I was a former city council representative in Columbia, Missouri, and as we talked about courageous leaders, so I was the bill sponsor for the first policy to be adopted in the state of Missouri, and have spoke, I think, at every council and hearing in the state of Missouri that is passed, asking folks like you guys to support this bill. As we heard from Deacon, and thank you so much. That was so touching and sweet. I've heard a lot of testimony on Tobacco 21 over the years, and that has been phenomenal. So we passed this in December of 2014, and again, being the first municipality in the state of Missouri. And I know I spoke before you guys back in May to a committee, but since then, several other jurisdictions in Missouri passed it. And as Karen had mentioned, now over a third of the state is covered by Tobacco 21, which wasn't the case when we first considered this policy. So it's moved very quickly. A third of the state is covered. It's actually, Tobacco 21 now covers more than comprehensive indoor air policy. It's a policy that's passed easily by council. It hasn't gone to constituents anywhere in the country. 20% of our country is now covered by Tobacco 21. And when nobody had even heard of this policy before 2013, when New York City passed it and they were the 7th municipality, it's moved very quickly. It's now in 15 different states, including surrounding states with jurisdictions of Arkansas, Kansas, Illinois, all have policy. So our neighboring states have municipalities with policy. It was brought up, and thank you again for your service to our country, but the military and where do they stand on this? So 2 states have passed this as a state, and right now it's actually being heard in 14 different states as a statewide policy. I could be wrong, Stan might be able to correct me, but it might be 18 now that have actually heard the statewide, but it will likely, it's been out of committee in Washington, so I know the supporters think that Washington State will be the next state to pass it, but it did pass in Hawaii, and so I want to tell you just a little bit about the Hawaii story. When they passed it, so the federal military bases don't have to enforce state policy, and so they really weren't sure if the military bases would apply Tobacco 21 on the bases. And right before the policy went into implementation, there was a letter that was received that made it very clear the military bases said, we want our military to be ready to serve, and tobacco is not going to make them ready. And so that they do apply Tobacco 21 on all of the bases. So it's the military has made a clear statement that they are in support of Tobacco 21. And as you see here, you have phenomenal community support from strong organizations. And it does take courageous leadership. You're not going to be the first, but you're still in the early stages of this around the country. Missouri is, only 15 states have passed this at a local level, and so we are on the early side, and it's really exciting for Missouri to be pro-preventative health for our children, and that's really what this policy is. Thank you, guys.
Thank you, Ms. Chadwick. Any questions? All right. Thank you. Next, we have Dr. Susan Voss. Welcome, Dr. Voss.
Thanks for having me to come today. My name's Susan Voss. I'm a pediatrician at Capital Region Medical Center. I've worked there for over 17 years, taking care of the kids of Jefferson City. I spend all day pretty much hanging out with babies up to teenagers, and I love my job. I want to do anything I can to help support protecting our youth, and I feel raising the smoking age and consuming tobacco age to 21 would do so much for them. I see firsthand the effects of smoking on our kids. From my newborn nursery rounds, we go and round on babies, and some of the babies are crying and they're fussy, and we look and their moms are heavy smokers. And those babies are born addicted to nicotine and have to withdraw from that. They did not ask for that. As they grow up, their parents who are smoking put them at higher risk for asthma and allergies. And as they continue to suffer from these and get admitted to the hospital and are on medications, their parents try to quit. I've had parents come up to me and say they would do anything to be able to quit smoking to protect their kids, and they can't. And then I take care of the teenagers, who are some of the most awesome and amazing kids we have in town, who are facing so many challenges, from being tempted with drugs and alcohol, and smoking is easily available and is felt to be something to de-stress them. And we don't know, and they don't realize the long-term effects that's going to have on their health. And if there's anything we can do to discourage that, to help protect them, as a pediatrician advocate for children in our community, I want to do that. So, thank you.
Thank you, Dr. Voss. Any questions? All right. Thank you. Dr. Gracio Nabain. Welcome, Dr. Nabain.
Well, thank you. Thank you for the opportunity of letting me speak. I am Graciana Bain. I am a pulmonologist at Capital Region Medical Center. I am here as a pulmonologist. I am also here as a mother of 2 children and a resident of the beautiful state of Missouri for almost 20 years. As a lung specialist, I have seen firsthand the damage that smoking addiction has caused to many adults. A common answer I hear, I wish I knew, I wish I never started. I really hope with the Tobacco 21, it would help deter young people from starting a bad habit, a habit that they may regret for the rest of their lives. As I have treated many people with emphysema, COPD, and lung cancer, most of which are preventable by not smoking, I cannot help but think had they not started earlier, they may not have been addicted, and maybe they would have prevented being so sick so early in their lives. What else? I think it is our obligation to send our youth a strong message. Smoking is bad for them. If a soon-to-be 12-year-old knows it's bad for them, hopefully they'll know as adults in community people, we know it's bad for them, and I hope passing this T21 would deter them from, again, starting a bad habit. So that's all.
Thank you, Dr. Nabain. Any questions of council? Well, we like to see you here. We don't want to see you when we're on the operating table. So it's good that you're coming here out ahead of that and really trying to educate the community and with your experience too, and also our pediatrician as well. So thank you both very much. Did I miss anybody else who is here to speak on this bill number 2016-120? I believe that concludes the list on that particular bill. And then next we have 2016-114, the Prescription Drug Monitoring Program, and we have Mr. Ron Skaggs signed up. Staggs, I'm sorry, Staggs. Thank you. Welcome, Ron.
Thank you very much. I have some handouts I'd like to present to you.
pass those around for you? Sure, we can pass them around. I'll share Phyllis's. Okay. Okay, on both sides here. Okay. And Mrs. Powell can scan this in for tomorrow. So here's a couple more we can pass down this direction.
My name is Ron Staggs. My background is I worked for Southwestern Bell as a data analyst, and when the prescription drug monitoring program came up, I started looking at what the CDC was putting out for particular numbers. Most people's eyes kind of glass over when you start talking statistics. So I gave you a couple of charts I want you to take a look at. The first chart that you'll see, it has the number 22 in it. That's how Missouri ranks as of 2015 amongst all the states, plus the District of Columbia. That means 21 other states, all of them with PDMPs, are worse than we are. So do we really have a prescription drug monitoring need for a program like this? Probably not. There are lots of different ways to solve the problem. When you're dealing with a problem that relates to chronic pain or emotional pain, those are the main reasons for people using prescription drugs, painkillers in particular. PDMP is a law enforcement tool. It's designed to catch doctor shopping. However, doctor shopping is built into the database, because the studies have shown from California's prescription drug database that up to 5 doctor shopping events can happen in 1 year and not be considered unjustified. And the reason behind that is that the patients are going undertreated. When the doctors begin to think that they're going to be monitored, they start restricting the level of pain medicine that they're dispensing. When they do that, the patients then suffer. They have to turn to the street, and often they turn to heroin to supplement, and then they OD. The next thing I'd like you to look at is the single-page chart. This is over time how Missouri compares to the national average and 2 other states. The red line is the national average. The blue line, dark blue line, is Missouri. The yellow line is New Hampshire. And then the final one is Kentucky. Kentucky is considered the blue ribbon or the gold standard for PDMP implementation. They started theirs in 1999. That's why I chose them. As you can see, within 2 years, they were above the national average and haven't dropped below it since. The other state, New Hampshire, implemented their PDMP in 2013. As you can look at the chart, they skyrocketed. They were below Missouri, and now they're way above Missouri. So how can you account for that? Is PDMP effective? These are not isolated cases. It runs completely across the board. Every one of these states that you see that are ranked below Missouri, 3 of those, Delaware and Maryland and New Hampshire, all implemented in 2013, and they skyrocketed. They were all above or better than Missouri prior to it. So what happens if we implement PDMP? We're going to have the unintended consequence of more people dying. It does not really save lives. It actually costs lives because of undertreatment. The patients then have to go out and find a source that will help stop their pain, plain and simple. And that's a problem that we cannot deal with a particular database that merely tracks doctor shopping. Since time is running out, I will also leave with you research. that says the PDMPs are not effective, and the CDC report that will give you more information on it. So thank you for your time, and I
Thank you,
hope you
Mr. Staggs.
reconsider taking this.
Thank you. Are there any questions? Councilman Henry?
Thank you, Madam Mayor. Sir, appreciate you coming and sharing your information with us. But I guess my question is to you, and we all know that PDMP is not the end-all, be-all. It's not the exact answer, but what's your solution then? What's the solution here?
Well, the solution is better drug treatment. A lot of people die not on their first incident. Their first incident is usually a visit to the emergency room. That's the people you should be tracking. Make it a misdemeanor if you're going to do something, and then require them to go into a drug treatment program if they are not legitimate pain prescribers. That's just one of the many solutions. But even in these reports that I'll give you, it outlines a lot of the programs that need to be implemented. But a PDMP is not really one of them. It's ineffective at saving lives.
Any other questions? Councilman Schreiber?
Yes, sir. If you provided this information, I apologize for missing it, but on the two graphs that you passed out to us, what was the source of those two graphs?
Those come from the CDC Wonder database, online database. I can send you a copy, and you can pull the same data available. But the Center for Disease Control puts this out, tracks it. They have from 1999 all the way to 2015.
Okay. Thank you.
Further questions? Councilman Laura Ward?
So this information is telling us that because these individuals couldn't get prescription pain medication through, basically illegally through a pharmacy, that they are converting to using street drugs, which is highly, causes overdoses.
Mm-hmm.
So, okay, so we need to focus more on our control there through policing?
Let me give you the scenario of exactly what happens. And studies from PDMPs, Virginia and Arkansas in particular, have all noted that their doctors, if Schedule 2 is the most potent painkiller, Schedule 4 is the least potent. They found that the doctors were, if they were taking, a patient came in and was taking Schedule 2, they switched them to Schedule 3. Still a 30-day supply, but the patient then, used to a Schedule 2, had to start taking, instead of a 24-hour time span, they'd run out because of the less effective dosage. They would run out by the end of the month because they had to move their pain taking of the medication earlier in time. When that happens, about a week in towards the end of the time, they're out of pain pills. They can't go to the pharmacy because the pharmacy's not going to issue it to them because of the PDMP. No, because they had the legitimate prescription. They filled it for prescription 3. They're used to prescription level 2, basically. So they have to take more often. So they run out of pills. If you're running your PDMP properly, no pharmacy is going to give you that pill because you still have 7 days left on your original prescription. So that's when they are forced to go out on the street. And unfortunately, since with PDMPs, the price of prescription pain drugs that are diverted, not through doctor shopping, but mostly through stealing from friends and family and neighbors, the price of those are so much higher, 3 to 4 times higher than heroin. Well, most people can't afford to pay that much difference, so they will go with heroin. And heroin now is being cut with what they call fentanyl. It's 75 times more powerful than heroin. And just a little bit of it in with heroin often ends up causing these people to die.
All right, did that answer your question? We good? Okay, thank you, Mr. Staggs. And next we have Christy Campbell, Director of the Cole County Health Department. Thank you. Welcome.
Thank you. Good evening, Madam Mayor, members of the council. As you know, I'm here to support the prescription drug monitoring bill. I testified last week, so you've heard a little bit, but I wanted to reiterate a few points tonight. Department of Health and Senior Services estimates that prescription drugs have quadrupled. Deaths from prescription drugs have quadrupled in Missouri over the last 10 years, and 3 out of 4 heroin addicts started out by using prescription drugs. In the United States in 2014, more people died from drug overdoses than in car accidents. So Missouri is the only state without a statewide PDMP. St. Louis County is developing this database and has invited other counties to join, other jurisdictions, and that's why we're here tonight. I would, in my 30-second description of a PDMP, I would describe it as a tool for prescribers and dispensers to use to see that prescription history for a patient. And it can be used in multiple facets, whether it's a individual nursing home. We just had this issue with a grandparent of mine that was had a fall a year and a half ago and was prescribed OxyContin, and then had another issue and another doctor prescribed another pain medicine. And here she was having issues remembering things in the nursing home. Finally, someone sat down, and because she lives in a state that has a PDMP, was able to review her prescription history and discovered that she was taking 2 Schedule II drugs that she didn't need to take anymore. And they're going to have to wean her off of those. So this is not just about illegal drug use. This is about managing prescription history for all patients. But yes, it will help deter those people that are getting those prescriptions illegally and from Missouri that don't live in Missouri and are taking them to other states because we're not tracking those prescriptions here. One trigger that our database will have that has been discussed a little bit is if a person has 3 or more prescribers or 3 or more pharmacies in the last 6 months, it triggers an alert to their prescriber. It doesn't go to law enforcement. It doesn't go to the health department. Like I said before, I will not be able to see, no one at my health department will be able to see prescription patient level data. We only get aggregate reports. So those alerts will just go to the prescriber so they can say, hey, you know, a patient of yours is visiting multiple pharmacies. You might want to do some intervention with them. There are also, you know, a patient of yours is also seeing a dentist who's also giving them some Schedule II narcotics for their pain. Perhaps there's another issue there. And it triggers that prescriber to meet with that patient and do some one-on-one counseling and to get them some intervention before they get addicted. This tool will not prevent individuals from getting the medication that they need. If an individual is getting medication prescribed to them by a responsible doctor in a responsible way, they're taking it the way they should be, and they're being monitored, this will not interfere with that. And they will be able to do business as usual. They will be able to get the medication they need and get the pain relief they need. We are not targeting anyone who is taking medication for their correct purposes and doing the correct things with them. So, like I said, I won't bore you with details, but if you have any other questions, I'd be happy to answer those now.
Thank you, Mrs. Campbell. Councilman Prather?
One of the biggest concerns that I've heard from some constituents is the safety of this collection of data.
Right.
And in particular for their children.
Right.
If their children are on, ADHD drug or something of that sort, what could you say to reassure those parents that that information is 100% safe?
Well, I probably explained again that this is just a database that will be used by prescribers and dispensers. You know, as we know, insurance companies do keep a list of the prescription medications you're taking because they're paying for them. And they would be the ones that said, oh, no, you're not ready for a refill, not the PDMP. The insurance companies or maybe the dispensers could say, well, it looks like you should still have 7 days on your supply, but the PDMP would not tell you that you could not have a refill. But for those people who have children that are on those type of medications, I would say their information is just as secure as it is now. This is not going to impose on that. And, you know, it could probably protect their children because who's to say that there's not someone who is doing illegal activity at that pharmacy and makes a copy of their children's prescriptions and sends it to the other states that have PDMPs and Missouri doesn't. So then, you know, someone is out there getting a prescription filled under their child's name and date of birth without you even knowing it. And then if Missouri gets a PDMP, they could track him can be like, oh, it looks like that you tried to get this filled in Kansas. Oh, no, we weren't in Kansas. That wasn't us. So this actually will protect their children from people trying to do illegal acts with their prescriptions.
And Mrs. Campbell, the county has already passed the PDMP at the county level, so some
Correct.
have asked, why does the city need to do that? And so, and there is no cost to the city, so wanted to
Yeah,
have
the
you
cost
touch on that.
right. It is, Ryan might be able to help me out with this because I'm not a lawyer. I have a geology degree. I confess to that. But it has to do with the way the county government is set up, and our county ordinances do not take effect within the city in the city of Jefferson because of your authority and our authority.
That's a fair assessment.
Okay.
Okay, great, thank you. So basically, this is necessary that the city take this step, not,
Correct.
since the county has it, doesn't mean that we are covered, so.
That is
We
correct.
need to take this step here. Any further questions for Mrs. Campbell? All right, thank you.
Thank you.
And we have Mr. Jim Marshall. Welcome, Coach.
Wasn't planning to speak, but I kind of feel obligated now too, since we've had kind of an opponent to this. So I'm just going to read you a few stats and make it clear and short. Florida, New York, and Tennessee are the last 3 states to adopt a PDMP. There's shown by the CDC as the last individual mentioned as the source for their stats, had a 23% drop in Oxycontin deaths. There's been a 367% increase in ER visits related to opioids the last 10 years in Missouri. A 22% drop in ER opiate visits to pill opiate issues in states that have PDMPs. A 41% rate of doctors say PDMP regularly affects how they dispense in states that have PDMP. Don't we want doctors to have all the information they need to prescribe safely to people that have multiple prescriptions? The Missouri Pharmacy Association has backed this and supported this at the state level. The Missouri Doctors Association, the Missouri Hospitals Association, the Dean of UMKC Pharmacy School came down here and lobbied for this last year. Why the increase in deaths in states with a PDMP? Well, we know that 80% of all heroin users started as a prescription addict. That's going to happen when we have PDMPs. It's shown to be true. That's going to falsely skew the fact that there are more overdoses in states with PDMPs. I don't know how to stop that, but I do know where they start. They start with the prescription addiction, and this is where our youth are getting most of their addictive situations on the street from, is from situations where PDMPs are not around. We can't track how many people have not developed a prescription addiction in states with PDMPs. So we can only look at the fact that, yes, overdose deaths have gone up in states with PDMPs. That's easy to track. Very easy. But I'm telling you, where a PDMP is available, there are probably many, many people who did not get into a prescription addiction because the PDMP forewarned doctors and forewarned pharmacists. They're our last line of defense. If we don't give them the ability to deny people who doctor shop, we're contributing to substance abuse ourselves. But I encourage you not to look at the rates of overdose deaths in the states with PDMP, because there is a heroin problem, and that's where they transition after the prescription addiction is no longer affordable. A bottle of Vicodin will run you $400. A bottle of Oxycontin will run you $500. Those kids eventually run out of the ability. You know, you look at the crime report they have in the papers, the Jeff City News Tribune, and you see the burglaries and you see the thefts, and you see all of these listed every day from the Jeff City Police Department in Cole County. Did you know that 90% of all crimes are committed by addicts? Especially when it comes to the youth, 75% of all kids that end up in a juvenile detention center never committed a crime until they did one thing: started using drugs. And this is our gateway right now. This is how we're transitioning into the criminal situations. The prescription gateway is our biggest gateway right now. It's not marijuana. In closing, I'll just say, you look at saving lives. When we were kids, we kind of thought people that saved a drowning person in a pool was a lifesaver. Someone that pulled somebody out of a fiery car wreck is a lifesaver. Someone that pulls someone out of a fire in a house situation is a lifesaver. I'm telling you, you have the opportunity tonight to save lives. And you have two opportunities, actually, when you talk about the nicotine and the tobacco connection that people are proposing here tonight. This is a lifesaver. This is throwing out a lifesaver or preserver to people that need it. So I thank you for your time, and I appreciate your attention to this effort. Are there any questions?
All right. Thank you, Mr. Marshall. All right, and next we have Father Stephen Jones with us tonight, and I believe changing the topic to Bill 2016-116. Yes. Yes, sure. You're signed up here already, so welcome.
To the end. Again, Brent Vanconia, St. Mary's Hospital, Jefferson City. Obviously, this is a very complex problem, and will take many tools in order to address it. I'm here on behalf of the St. Mary's Medical Group and really the physicians in Jefferson City. They are pleading for your help on this issue. SSM is has been lobbying at the state level for many years, and we regret that you are in this position to have to make a decision that the state's refusing to address when 49 other states have already done it. And so we're going to continue that effort at the state level. But given we have an opportunity here to provide a tool that our physicians are pleading for, they're seeing these patients in their offices every day. They're looking for tools in order to help identify and help manage them for those who are shopping, either for themselves or to sell those. So again, you have an opportunity here to provide a tool and a resource that's going to be part of an arsenal, a broad arsenal that's needed in order to address this. And so I plead for your support.
Thank you. Any questions for Mr. Vanconia? Thank you for the hospital's perspective, and I know we also heard at a committee meeting that the pharmacies are also supportive as well.
Yes, and we're actually very pleased. This is a community-wide support. You know, again, piggybacking on what St. Louis Community doing, also working with the Department of Public Health, the St. Louis County. There's a broad community-based support addressing the whole problem, but also hoping and supporting PDMP.
Wonderful. Thank you. And welcome, Father. Oh, Brent, I'm sorry, Gasper now. Thank you. Welcome, Mr. Galvez.
It's not that I don't want Brent to upstage me. We work very, very closely together on a number of issues, and I didn't want mine not getting up here to be an omission of our support for this. Much like SSM, Capital Region has a large medical group, over 120 providers, and talking with our ER physicians, they are pleading, as Brent mentioned. So I just wanted to come up here and also state us too, and that we're very, very supportive of this bill.
Thank you. Well, I appreciate hearing from the hospitals. That means a lot, so thank you. And welcome, Father Stephen Jones. Well, I didn't think we could have had you do another prayer for us this morning, or earlier in the meeting.
There you are, Madam Mayor. You know, it takes an important topic to keep a priest away from a microphone, so thank you all for speaking to this. Madam Mayor, ladies and gentlemen of the council, I am not an engineer, so I will defer to those who have better technical knowledge, but I stand before you as the president of Elias Catholic High School. Many of you, of course, know that we are undertaking some major capital improvements and buildings on our campus, including a very significant athletic complex, and we're very excited, and I stand here in support of a proposed hopeful development agreement between Elias Catholic High School and the city to do some improvements on the Myrtle Street intersection, Swift's intersection, and working together later, of course, down by Stadium Boulevard. So while I am not qualified to answer any technical questions, I certainly would be open to any other kind of questions about what we're trying to do.
Thank you. Any questions for Father Jones? Great. Well, appreciate you being
I like that
here,
as well.
and
Thank you very much.
I know I've spoken with Mr. Marash about wanting to have a tour and come out and take a look at the renovations, and I'm sure that any council members would be welcome to do that as well. So I will look forward to that too. Thank you. All right, that concludes item 10, presentations. Item 11, consent agenda. Is there a motion?
So moved.
Any further discussion? All in favor? Any opposed? Motion passes. Item 12, bills introduced, 2016-115.
An ordinance of the City of Jefferson, Missouri, authorizing the mayor and city clerk to execute an agreement with Cole County setting procedures for joint city and county capital improvement sales tax projects.
Mr. Marash?
Thank you. As clerk indicated, this agreement with Cole County and the city
And basically, we do these each time we get in a capital improvement, cooperative capital improvement project. And this agreement actually lists two projects. One, Father Jones just mentioned on Myrtle Street, where we would undertake a project to correct some site distance issues on Myrtle Street, kind of in midstream of the campus there at Helias. And Cole County has indicated their willingness to have this be a part of a capital or joint capital project. So the agreement basically limits this is the agreement with the county. So it indicates $500,000 be split each way, and the city would be the lead on the project for the two. The second project's Capitol Avenue. The estimate for it right now is $1.6 million. And again, the county has indicated willingness to split costs with us on that as well. And these were all half-cent capital improvement sales tax projects. They go through a process of design, various public meetings, things of that nature, and the agreement basically outlines each party's responsibility as it relates to them.
Great. Any questions for Mr. Marash? All right. 2016-116.
An ordinance of the City of Jefferson, Missouri authorizing the mayor and city clerk to execute a development agreement with Helias Catholic High School for the reconstruction of the 1200 block of Myrtle Avenue.
Thank you, Mr. Marash.
Okay, thank you. Yeah, this is kind of the tandem bill, but this is the development agreement then about Myrtle Avenue with Helias. Basically, it, again, indicates each party's responsibility, the city and the Helias. And we put a screen up here just to make this a little more clear of what's going on. But what we're talking about is really outlined in red. If you've been in the area, Swifts Highway and Myrtle Street has an offset intersection. And right now there's a site distance issue in that area. And then there's also one kind of to the right of the red area where the new driveway to the sports complex would be another site distance issue. So this project would correct all of those site distance issues, and basically Helias has agreed to any additional right-of-way or modifications to their site plan or parking lots to make this happen. They would agree to that. The city's contribution to be limited to $500,000, or the city and county's contribution be limited to $500,000 total, and it also allows Helias to place a pedestrian underpass, and I don't have my pointer, but it's very near the Swifts Highway, in between the Swifts Highway offsets, so they're contemplating putting a pedestrian underpass under there. Doesn't require them to, but if they so choose during construction, they certainly can. I think they're still willing to trying to do that. But also the agreement really puts the project in their hands to accomplish at the same time that they're under construction on their own site, so it really they're the driver of the schedule more so than us. And so I think that's helpful to both parties, have one contractor responsible and could get the work done on their schedule. But I'd be happy to answer any questions. There's obviously various other things in there. The city we've already designed the project from a city staff point of view, and be happy to answer any questions.
Thank you. Any questions for Mr. Marash? All right. 2016, oh, yes.
Point out one other thing, since I have this shot up here, I forgot. The other thing the city does get in return, the green slide to the left there is a roundabout. That's down at Myrtle and Stadium, and so we've identified through a traffic study in the past that there is a need for an intersection improvement there. So as part of this agreement, Helias is also agreeing to donate any right-of-way they may have that would be needed for that project in the future. Doesn't obligate us to build it, but we think at some point in time the city would like to probably do an intersection improvement there, and so Helias would then cooperate and provide any right-of-way they have that would be needed for the project.
Great. Well, thank you, Father Jones, for that. That's good. Thank you. Any other questions? All right. 2016-117.
An ordinance of the City of Jefferson, Missouri accepting and approving the final subdivision plat of Capitol Mall subdivision, a subdivision of the City of Jefferson, Missouri.
Mr. Sanders?
Thank you, Madam Mayor. When Capitol Mall was first developed, it was not subdivided into individual lots. In 2013, the City Council and the owners of Capitol Mall entered in a development agreement which would facilitate dividing up the property into individual parcels. The subdivision plat has gone through the Planning and Zoning Commission, It doesn't really create any new parcels. The parcels are along existing tax parcel lines. There's approximately 11 parcels. 4 of them are undeveloped at the time. The buffer yard is still over on the east side, and the forested area behind the theater is still included there too. The Planning and Zoning Commission approved it unanimously, 8-0. It's been reviewed by Public Works, and they have approved it, and the Planning and Zoning Commission has forwarded it to you for recommending approval. I'd be glad to answer any questions.
Any questions? All right. Thank you. 2016-118.
An ordinance of the City of Jefferson, Missouri, authorizing the mayor and city clerk to execute a supplemental agreement with Lockmuller Group Incorporated for the Jeff Tran system-wide assessment.
Mr. Sanders?
Thank you, Madam Mayor. This is correcting a small error that made it through both Lockmuller and our team here at the city. MoDOT noticed a little discrepancy in the attachment of the costs. Basically, Lockmuller had the final price there, but they forgot to add in a column for one of their employees, which affects their fixed fee amount, the amount of money that is going to be their profit, per se. So this basically is just correcting the Scrivener's error. There's no fiscal impact to the city at all.
Great. Any questions? We'll have to let Scrivener know that there's a Scrivener's error there. He'll be glad to hear that. 2016-119.
An ordinance authorizing the mayor and city clerk to execute an agreement between the City of Jefferson and Burns and McDonnell Engineering Company Incorporated for professional services at the Jefferson City Memorial Airport.
Mr. Marash?
Thank you, Mayor. As clerk indicated, this is an agreement with Burns and McDonnell for engineering at the city's airport. The basically what it is, it's kind of like a standby type agreement, if you will. Working with through MoDOT and the FAA, they would like us to have a provider of engineering services on call, if you will. And so we go out one time for a request for qualifications, then have this contract. So now as projects would arise, we'd be using Burns and McDonnell to engineer those over the next 5-year period. Now, the last 10 years, the city's already utilized Burns and McDonnell for this service. And again, be happy to answer any questions.
Any questions? Thank you. 2016-120.
An ordinance amending Chapter 18 miscellaneous provisions and offenses of the Code of the City of Jefferson, Missouri, relating to the sale and possession of tobacco products, alternative nicotine products, vapor products, and tobacco paraphernalia.
Mr. Molman?
Thank you, Mayor. This bill amends Chapter 18 to raise the age for the for the sale of tobacco and related products from 18 to 21 years of age. This bill also includes definitions for tobacco products, alternative nicotine products, and vapor products, which are consistent with state statutes, creating a definitional consistency between local ordinance and state statute. That makes things on the enforcement side a little bit easier. And then I also want to note that this bill leaves the age for possession of alcohol at of tobacco products and related products at 18 years of age. So in the hypothetical of someone leaving Jefferson City under the age of 21 but over the age of 18, leaving Jefferson City, buying tobacco products somewhere else and then bringing that back into the city, that would not be a violation of the ordinance as long as they are over 18. It's just a prohibition on the sale of tobacco and nicotine and vapor products to persons under the age of 18 within city limits.
Thank you, Mr. Molman, and that is an important distinction. It's only for the sale of tobacco products, not raising the age. So thank you. Any questions for Mr. Molman? Or deliberation? Councilman Mahalovich?
I think this has an opportunity to, hopefully not to have a divided council on this issue. I hope we can have an open mind about this. I looked at the charter and asked Ryan to say what our purpose was as a council, and I couldn't find specifically what we swore to, other than to uphold the charter, Constitution of Missouri and United States. But it really, what our purpose comes down is to three things, as I see it, is the health, safety, and welfare of our residents. And we do take that mainly, we look at our police and our fire over there, and that's pretty easy. But I think it's broader than that. And I think as we do an introspection of ourselves and what we're about, I think we ought to look at our role as protecting the health, safety, and welfare of all our residents. And so I just ask that we keep an open mind about both of these issues.
Thank you, Councilman Mahalovich. Any other questions or comments, deliberation? I appreciate the community coming out in such strong support, and I know there are others here that didn't come to the podium that are representatives, because I've seen you at some of the open houses that you all have held in the community that I've attended, and appreciate that. That's something we didn't note earlier, is even though this did come to council about a year ago around May, with students coming to the podium actually asking the council to consider it, and it's been discussed at various committees, but never actually ended up here in the council chambers about a specific bill. So I do appreciate that the American Heart Association has provided a bill, because we know that it is supported also by the Heart Association and medical community, which is important. So we have an example before us that is successful. And I appreciate the words, I believe Mr. Vanconia and several others who said that it requires courageous leadership. And we are the state capital, and so hopefully we can be a leader, and also was mentioned about growing Jefferson City and being a leader in healthcare initiatives. But having physicians here as well, having Dr. Voss, having Dr. Nabane, and hearing the quote, "I wish I never started," and this legislation does just that. So I appreciate council being open to that and that coming to council to consider. So appreciate the community support that was shown here this evening. Is there any further questions or comments from council? Mr. Henry?
Ryan, I know you just spoke on this in regard to primarily the sale of tobacco products.
Yep.
So when you're talking about possession, that doesn't deal with anyone with possession of tobacco products under 21 here in town?
That's correct. It keeps the status quo at 18. So like I said, if someone were to go out of town into the county, perhaps, and buy tobacco products who are, say, 20 years old, and then bring that back into the city, they would not be in violation of anything in this ordinance.
Thank you.
And that's a good point, Councilman Henry, and I think to simplify it, it's only the sale.
The best way I got my mind around it, this is a restriction on the sellers of tobacco, not on the possessors of tobacco.
Right. Okay, thank you. Any further questions? Thank you. All right. Bills pending number 13, 2016-105.
An ordinance of the City of Jefferson, Missouri, amending the fiscal year 2017 budget of the City of Jefferson, Missouri by appropriating additional funds within the Capital Improvements Sales Tax G 17-22 Fund.
Margie Miller, please.
Thank you, Madam Mayor. This amends the FY17 budget by recognizing the revenues and expenditures for Capital Improvement Sales Tax G. Those revenues generated from Sales Tax G were not included in the FY17 adopted budget due to the short time frame between the approval of the ballot measure on August 2nd and the adoption of the FY17 budget. So the sales tax G is estimated to generate $5 million per year. This request is for half a year, or $2.5 million.
Thank you. Any questions for Mrs. Miller? All right. 2016-106. Oh, I'm sorry. We're on bills pending now. Roll call, please.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Wiseman. Aye.
Bill passes. 2016-106.
An ordinance of the City of Jefferson, Missouri, revising the vehicle for hire requirements found in the city code and allowing transportation network companies within the city and regulating their operation.
Mr. Molman?
Thank you, Mayor. This is the bill that would allow transportation network companies to operate within the city. The bill is consistent with the current state bill running its course through the General Assembly. The other major component of this bill is that it makes some changes to the taxi cab regulations. The largest feature of that is getting rid of the certificate of convenience and necessity, making a little bit more even playing field, if you will, by taking out a discretionary decision of city staff as to whether or not a taxi service is needed within the city. Basically, it sets up a system if someone is able to fulfill all the requirements of the taxi cab regulations, then they would be able to be issued a operator's license to run a taxi cab business, taking away the discretionary part of that decision making. And then it also amends the taxi cab driver's permit system. Currently, drivers of taxi cabs annually get a permit from the city. This ordinance changes that system where they would get a one-time permit from the city, and then it is the responsibility of the taxi cab companies themselves to review their drivers to determine whether or not anyone falls out of compliance with the driver requirements. And then if anyone does fall out of compliance, the taxi cab company would be required to inform the city of that situation and keep all records of those reviews, and then also be subject to audit by the city in case any problems come up. So really two features of this bill, allowing TNCs, which include companies like Uber, Lyft, and other ride-sharing applications, and then really relaxing some of the regulations on taxi cab companies.
Thank you. Any questions for Mr. Molman or deliberation? Councilman Graham?
I have a question. If this passes tonight, is there a time frame in which Uber or Lyft can start operating in Jefferson City if this passes tonight? What's the time frame?
The permit that's required of TNC companies to operate, and that is the only permit that is required, it's of the company themselves and not the drivers individually. The permit that's required under this bill is simple. It's a really simple permit. I couldn't imagine it would take too long for city staff to turn that around. I imagine if Uber came in tomorrow with an application, we could probably get that turned around, early next week. It's really a pretty simple process. I did reach out to Uber to see if they had any firm plans on how they saw when operations would roll out in the city. I haven't gotten any feedback on that question yet.
Councilwoman Wiseman?
I just wanted to say that I've gotten quite a bit of feedback from several constituents, specifically sight-impaired constituents, and actually got another phone call today to indicate how important Uber has been just for their travel. They use handy wheels, taxi cabs, and several other, forms of transportation if available, and Uber on Inauguration Day was really great and almost freeing for several of them. So I just wanted to mention that.
Thank you. Councilman Mihaljevic?
Yeah, I just want to say that I appreciate the city administrator and our council have worked with Tom Landwehr personally with his views with regard to existing cab service, and he testified at our public safety meeting, and when fronted with the ability to us to back off of some of our regulations, he actually bolded us by saying, those are what makes my service value added. So he feels that he has a value-added service. He has clean cars, 4 doors, less than 10 years old, that are going to be marked, that are going to be have the city's regulations towards it. And so therefore, I think those that don't have a credit card that still want to use a cab has a valuable alternative. As well as, I want to say that this bill, as mentioned, doesn't preclude a checker cab driver from being an Uber driver in our regulations. Is that correct?
That's correct. It would allow the opportunity, a clarification included within this bill that says essentially is that nothing in this bill would prevent a taxi cab driver from operating under a TNC.
And the last comment that I made is he is going to continue a 24/7 service. So that was one of my big fears, is that we could be left without service at critical hours of the night. So that's all intact, and I certainly appreciate Tom Landwehr for working with us on this.
Absolutely. We appreciate his support and seeing that we can work with existing businesses that do provide a valuable service in our community. And also, at the same time, this is a great example that we can be a leader in the state by passing this bill. So thank you. Any further comments? All right, roll call, please.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Branch.
Aye.
Bill passes. 2016-107.
An ordinance of the City of Jefferson, Missouri, amending the 2016-2017 budget of the City of Jefferson, Missouri by appropriating additional funds within the general fund.
Chief Schofield.
Thank you, Madam Mayor. This bill would allow us to pay off our current turn-in lease program that we entered into back in 2008 with PNC Financial, which is the parent corporation to Pierce Manufacturing. In addition to saving us a little over $37,000 in interest by paying off early, it also gives us the ability to have better negotiating power with all vendors and manufacturers going forward. This is really part one of two of a of overall fleet maintenance plan that we plan to present very soon to the council. But clearing this hurdle would allow us to negotiate those prices and bring back a proposal for replacement apparatus in the near future. Be happy to answer any questions.
Council comments? Councilman Graham?
Could you remind us what that balloon payment was?
Yes, so this is going to incorporate the 10th payment, which would be due next year in March 7th of 18, which is $74,74.71, as well as the balloon payment, which is $827,000, $327.77. I'm sorry, let me say that one more time. $827,327.77 was the balloon payment. So those two in combination together represent the total payment due, and then we are free and clear of this turn-in lease program.
And then we would start the process of looking of how we want to do the next years with our apparatus and all those.
Yes, and we really feel like this is an optimal time for us to capture some of the equity that we have in the current fleet, and by owning that fleet, we're able to negotiate that completely and give you all the information in a complete package, hopefully within the next month or two.
Further comments? All right, roll call, please.
Henry.
Aye.
Lubert. Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Branch.
Aye.
Graham.
Aye.
Bill passes. 2016-108.
An ordinance of the City of Jefferson, Missouri, authorizing the mayor and city clerk to execute a $35,820 agreement with Independent Electric for electric motor repairs.
Mr. Marash?
Thank you. As clerk indicated, this is an agreement with Independent Electric, and they repair our electric motors, or would repair our electric motors. Basically, a lot of our wastewater components would utilize this contract most heavily, but it's open to others, other departments in the city if they have need for it. And the agreement is shown as about $36,000. That's just based on history, and be happy to answer any questions.
Questions or comments? Roll call, please.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Bill passes. 2016-109.
An ordinance of the City of Jefferson, Missouri, vacating and discontinuing a sanitary sewer easement over a portion of property addressed as 3519 Bennett Lane in the City of Jefferson, Missouri.
Mr. Marash?
Thank you, Mayor. Basically, like the clerk indicated, this would vacate a sanitary sewer easement, and it's related to the construction of the SOMO project, Special Olympics of Missouri project, and they decided to take a different route with the sewer and would vacate the portion no longer needed.
Any council questions, deliberation? Roll call, please.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Bill passes. 2016-110.
An ordinance of the City of Jefferson, Missouri vacating and discontinuing a sanitary sewer easement over a portion of property addressed as 2821 and 2827 South 10 Mile Drive in the City of Jefferson, Missouri.
All right. That is Mr. Marash again. Thank you, Matt.
Thank you. Again, another vacation related to sanitary sewer. This is related to the Goodwill project, now under construction, and would vacate a sanitary sewer no longer needed.
Questions, comments? Roll call, please.
Prather.
Aye.
Schreiber.
Aye.
Ward. Aye. Wiseman.
Aye.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Bill passes. 2016-111.
An ordinance establishing an administrative delay on the processing of applications for demolition of structures which are at least 50 years old within an area bounded on the north by State Street, the west by Adams Street, the south by Commercial Way, and the east by Lafayette Street.
Mr. Molman?
Thank you, Mayor. This bill imposes a 4-month administrative delay on the issuance of demolition permits in the East Capitol area as described in the bill. City is currently looking at least 2 different ordinances which would address the situation in the East Capitol area, particularly overlay zoning district, and then also potential changes to the historic preservation ordinance. This bill would stop issuance of demolition permits until July 6th of this year, and allow the city to study and consider those bills without exacerbating any potential problems that could come forth with development with demolitions in the areas without the advantage of those bills.
Any questions, deliberation? Roll call, please.
Schreiber.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Bill passes. 2016-112.
An ordinance of the City of Jefferson, Missouri amending Section 19-401 Motor Vehicles and Traffic, Schedule V, accessible parking spaces of the Code of the City of Jefferson by the addition of portions of East Capitol Avenue.
Mr. Marash?
Thank you. As the clerk indicated, this would modify our parking schedule and it would add an accessible or an ADA space in the 300 block of Capitol, and it's adjacent to the Methodist Church on that block. These requests go through our Traffic and Transportation Commission, sometimes referred to as TNT, and they have reviewed the request and recommend approval.
Thank you. Any questions, deliberation? Councilman Graham?
So Matt, how many ADA spaces does that give for that church, for those 3 churches there?
I don't off the top of my head know the inventory, but we do try to strive for like 1 per block at least.
Okay.
And again, the purpose of going through the TNT or the Traffic and Transportation Commission, say somebody requested multiple spaces, it would at least allow the opportunity to notify the adjoining property owner, see if there's a problem with it in those kind of instances, things of that nature. But I don't think we have an excessive amount there.
So I was thinking that there was like 1 or 2 that was there, but they were in a bad location or something like that.
We're not removing any, we're
Right.
adding one.
Okay.
So,
okay.
Any other deliberation? Roll call, please.
Ward.
Aye.
Wiseman.
Aye.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Bill passes. 2016-113.
An ordinance of the City of Jefferson, Missouri amending Section 19-401 Motor Vehicles and Traffic, Schedule J, Parking Prohibited, Subparagraph A of the Code of the City of Jefferson by the addition and deletion of portions of Dunklin Street.
Mr. Marash?
thank you. Again, another request that came through the Traffic and Transportation Commission. What it would do is remove about 6 parking spaces on the 400 block of Dunklin Street, which is adjacent to the mid-block crossing that leads you to Employment Security Office. Several years ago, the city and the state, if you will, had an agreement where they would pay for that crossing, and the city designed and implemented the crossing. There is a slight, this would improve the sight distance at that crossing by removing those vehicles as vehicles approach the crossing.
Any deliberation, questions? Roll call, please.
Wiseman.
Aye.
French.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Bill passes. 2016-114,
An ordinance of the City of Jefferson, Missouri revising Chapter 15 of the City Code relating to a prescription drug monitoring program.
Mr. Molman.
Thank you, Mayor. This bill is the Prescription Drug Monitoring Program bill. Ms. Campbell from the Cole County Health Department is here to answer any technical questions on the program itself, but essentially this ordinance requires that dispensers of Schedule 2, 3, and 4 drugs participate in the Prescription Drug Monitoring Program at any time that Cole County has that program in effect. This bill was sent to St. Louis County Department of Public Health. They gave it its okay and told us it's good to go and it's consistent with their program, which is the program that Cole County Health Department is in partnership with.
Thank you. Any questions, deliberation? Councilman Henry?
First of all, I'd like to thank Ms. Campbell and Coach Marshall for coming back and visiting us again and speaking on this subject. This one's a pretty touchy one for me. I'm not sure how many know, but I work with I actually run our drug courts here in Cole County, and we've had plenty of participants in our programs that have doctors shopped, whether it's been going to physicians, whether it's been going through emergency rooms, however they can get it, they've tried. And it continues to be an issue, and as I already mentioned, this is simply a tool. This is not the end-all, be-all, but it's a tool that we need to have, we should have, but it simply also lets us know that we still have plenty of work to do in this area. And so I'm in full support of this. I thank the county for what they've already done in terms of passing their portion of this, and I hope we could do the same.
Thank you, Councilman Henry. Further questions, deliberation? And I echo your comments about appreciating the work of the county and that hopefully we can follow along with them, so appreciate their leadership on this as well. All right, roll call, please.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Bill passes. Item 14, nothing on the informal calendar, no resolutions tonight. Presentations from the gallery on other topics. We have nobody signed up this evening. Item 17, any council and staff discussion on presentation topics? Item 18, any new business? 19, any unfinished? I want to mention, too, I said earlier that we have a school board candidate forum here in council chambers tomorrow night on Tuesday, March 7th, 6 p.m. But I also want to mention the City Council Candidate Forum, which is Tuesday, March 21st in council chambers at 6 p.m. Both of those are sponsored by the News Tribune, so thank you to them for sponsoring, and those are both for the April 4th election. Item 20, approval of closed session minutes. Is there a motion? Mrs. Powell, roll call, please.
Branch.
Aye.
Graham.
Aye.
Henry.
Aye.
Lubert.
Aye.
Mahalovich.
Aye.
Prather.
Aye.
Schreiber.
Aye.
Ward. Aye. Wiseman.
Aye.
Motion passes. Item 21, is there a motion to adjourn? All right. All in favor? Thank you.